Good day, I am Clinical Clerk Tristan Victor Rayton Santos RN, and here is my ENT OSCE video Season 2. Both the patient and the examiner wash their hands prior to the conduct of the OSCE. Face mask and face shield were used by the patient and the examiner. Proper health protocols prescribed by the Department of Health were observed in this video. For all the procedures, first, introduce yourself, ask for consent, and explain the procedures to your patient. It is always valuable to establish trust and explain the procedure to the patient. In this Dix-Hallpike test, we will be testing for the presence of vertigo or the sensation that you or the environment around you is moving or spinning. With the patient looking at the examiner's nose throughout the maneuver, the examiner then will tilt the patient's neck laterally at about 45-degree angle and extend the neck at about 20 degrees, and with one swift motion, bring the head down. This movement may make the loose crystals move within your semicircular canals. Ask the patient if she feels symptoms of vertigo and check the eyes for any signs of nystagmus. A positive Dix-Hallpike test consists of a burst of nystagmus or the jumping of the eyes. The head impulse test works by testing the vestibulo-ocular reflex. This reflex is helpful to maintain corrective eye position during any change in head position and to correct the eye movement rapidly so that vision remains on the target. Sit at the same level with the patient. Explain the procedure and ask the patient for consent. Ask the patient to look at the examiner's nose. Then the examiner will twist the patient's head in a quick motion from side to side and observe whether the eyes are performing correctional saccades. An abnormal response is indicated by an inability to maintain fixation during head rotation with a corrective gaze shift after the head stops moving. An abnormal test seems to be sensitive but not specific for a peripheral vestibular disorder. Installation of nasal spray. Prior to the administration of the nasal spray, ask the patient to gently blow their nose to clear the nose. When using the nasal spray, instruct the patient to tilt their head forward and pinch the nostril that will not be sprayed. Upon the administration of the spray, ask the patient to do a sharp inhale accompanied by the squeeze of the bottle. The Barton bandage is frequently used for fractures of the lower jaw and to retain compresses to the chin. First, we need to start from the top like hairband, and we should go around the mandible. Then, we need to take it backwards, and it should go behind the ears, and it should come in front by covering the chin, and it should rotate and should go back and get rotated around the patient's head. It should come in front and check for the covering of the chin as a whole. It should be little loose and not so tight so that the patient can open and close their mouth in limited motion. Before tying or putting pin, check for the looseness and the efficiency of opening the mouth, about 1 or 2 finger gap, so that it is easier for them to eat. By tying it this way, it can provide to the mandible stability and support during mastication and speech and prevent redislocation of the mandible. After all the procedures, we thank the patient for her cooperation. In this Season 2 of my ENT OSCE video, I thank again my sister for being my patient in this OSCE video. Thank you and God bless us all.